Colon polyps and colonoscopy are subjects that can cause a great deal of concern and curiosity. Many people have heard about colon polyps during discussions about colon cancer or routine health screenings, but few truly understand what they are, why they matter, and how they are managed. Here, we'll address 10 of the most frequently asked questions about colon polyps and colonoscopy, providing clear and comprehensive answers that aim to inform and reassure. First, what are colon polyps? Colon polyps are small growths that form on the lining of the colon or rectum. Most polyps are benign, meaning they are not cancerous, but some can develop into colon cancer over time. Polyps vary in size and shape. They might be flat, raised, or attached to the colon wall by a stalk. There are several types of colon polyps, with adenomatous polyps being the most common type that may have the potential to become cancerous. Hyperplastic polyps, on the other hand, are usually harmless. Second, why do colon polyps form? The exact cause isn't always known, but polyps develop when cells in the lining of the colon grow and divide more rapidly than they should. This abnormal growth can result from genetic factors, chronic inflammation, or lifestyle choices such as a diet high in fat and low in fiber, smoking, excessive alcohol use, and lack of regular exercise. Age is also a significant risk factor. The likelihood of developing polyps increases after the age of 50. Third, what are the symptoms of colon polyps? Most colon polyps do not cause symptoms, which is why screening is so important. However, larger polyps, or those located in certain areas, can cause symptoms such as rectal bleeding, changes in bowel habits like diarrhea or constipation, abdominal pain, or iron deficiency anemia due to chronic blood loss. If you notice any of these symptoms, it's important to consult a healthcare provider. Fourth, how are colon polyps detected? Colon polyps are typically detected during a colonoscopy, which is considered the gold standard for screening. During this procedure, a thin, flexible tube with a camera on the end is inserted into the rectum and advanced through the colon. The doctor can see the inside of the colon and identify any polyps or abnormal areas. Other screening methods include flexible sigmoidoscopy, CT colonography, and stool-based tests, but only colonoscopy allows for both detection and immediate removal of polyps. Fifth, what is a colonoscopy like? For many, the thought of a colonoscopy can be intimidating, but the procedure is usually straightforward and safe. Before the colonoscopy, you'll need to follow a special diet and take a bowel preparation medication to clean out your colon. The procedure itself is typically done under sedation, so you're relaxed and comfortable. The doctor will carefully examine your colon, and if polyps are found, they can often be removed during the same procedure. Most people recover quickly and can resume normal activities the next day. Sixth, are all colon polyps dangerous? Not all polyps are dangerous, but some do carry a risk of turning into cancer. The risk depends on the type, size, and number of polyps found. Adenomatous polyps, also known as adenomas, have the greatest potential to become cancerous, especially if they are large or show certain cellular changes under the microscope. Hyperplastic polyps and inflammatory polyps are generally not considered precancerous. However, the presence of any polyps may indicate a higher risk for future polyps, so regular follow-up is important. Seventh, how are colon polyps treated? The primary treatment for colon polyps is removal, which is usually done during the colonoscopy. Smaller polyps can be snipped off with tiny instruments, while larger ones may require more advanced techniques. Rarely, if a polyp cannot be safely removed endoscopically, surgery might be necessary. Removing polyps is important because it eliminates the potential for them to develop into cancer. After removal, the tissue is sent to a laboratory for analysis to determine the type and whether any further treatment or follow-up is needed. Eighth, what happens after polyps are removed? After polyps are removed, your doctor will let you know when to schedule your next colonoscopy. The timing depends on the number, size, and type of polyps found, as well as your overall risk factors. For example, if only 1 or 2 small polyps are found, you might not need another colonoscopy for 5 to 10 years. If you had larger or multiple polyps, or if they showed significant changes under the microscope, your doctor may recommend more frequent screenings. The goal is to detect and remove any new polyps before they have a chance to become cancerous. Ninth, can colon polyps be prevented? While not all polyps can be prevented, there are steps you can take to reduce your risk. Eating a diet high in fruits, vegetables, and whole grains, and low in red and processed meats is associated with a lower risk. Regular physical activity, maintaining a healthy weight, not smoking, and limiting alcohol intake are also important lifestyle choices. For some people with a strong family history or genetic syndromes that predispose them to polyps, additional preventive measures and earlier screening may be recommended. Finally, who should get a colonoscopy and when? Most guidelines recommend that adults at average risk for colon cancer begin screening at age 45 or 50. If you have a family history of colon polyps or colon cancer, or if you have certain risk factors such as inflammatory bowel disease, your doctor may recommend starting earlier and screening more often. Colonoscopy is a powerful tool for both detecting and preventing colon cancer, and following your doctor's advice about screening is one of the most effective ways to protect your health. Understanding colon polyps and the role of colonoscopy in their detection and removal is crucial for maintaining digestive health and reducing the risk of colon cancer. Knowledge empowers you to take charge of your health, ask the right questions, and make informed choices about your care. If you have concerns or questions about colon polyps or colonoscopy, don't hesitate to speak with your healthcare provider. They are your best resource for guidance tailored to your individual needs.